We're going to talk today about prenatal care. Prenatal care, the relationship between a woman and the healthcare professional entrusted with guidance for her pregnancy. Well, the first thing that we have to ask ourselves is it necessary to establish prenatal care? The answer is absolutely yes. And the reason is because prenatal care would allow you to have enough confidence that the process of pregnancy is going well. During prenatal care, you will receive the guidance and the reassurance that you need in order for you to be able to enjoy the pregnancy. But when should you start prenatal care? Well, it really depends on the underlying conditions, but the majority of patients, once you know that you have a positive pregnancy test, you need to start making the arrangements for you to be able to establish your prenatal care. Often, getting closer towards the end of the first trimester will be a good idea, unless you have underlying conditions. If you have high blood pressure, or you have a history of diabetes, or problems with previous pregnancies, you might need to be seen earlier than 12 weeks of pregnancy. Who do you see for your prenatal care? Well, it is your choice in general. We have different types of professionals. We have your regular midwife who will take care of your pregnancy. They usually take care of pregnancies that are not complicated. You can have a family physician, or you can have your obstetrician and gynecologist as well. Obstetricians and gynecologists will be able to provide you with surgical care, like doing a cesarean section, as well as many family physicians would do as well, who have received the training for that. In certain cases, women need a very specific care by a more specific, more skilled, trained type of physician or type of healthcare professional. They are called maternal fetal medicine specialists or perinatologists. They are the ones in charge of very complex pregnancies, like certain types of twin pregnancies, for example. What should you expect during the prenatal care? Well, one of the most important things in the prenatal care is that you need to establish a relationship with that person who's going to guide you through the process of your pregnancy. That person, your clinician, should know you and be aware of all the details of your pregnancy. They should know about not only your lab tests, but also how you're progressing through the pregnancy and how well your baby is doing. All of your questions should be answered. You should never feel that you don't understand what is going on with you during your process of pregnancy. That person guiding you through that process, that clinician, should actually give you that reassurance that everything that you want to know, you've been told. But what happens during those prenatal visits? Well, during your prenatal visits, you usually get evaluated for your weight. We want to make sure that you're gaining appropriate weight because that is an indirect measure of the growth of your child. Starting also as early as 12 weeks of pregnancy, your clinician could check the fetal heart tones, that is, listen to the heartbeat of your child with a small device called a fetal heart monitor. Now, later on, you're going to get laboratory testing as needed for different things. We're not going to detail them here, but there are multiple laboratory tests that are done throughout the pregnancy on normal pregnancies. If you have an underlying condition, you might need additional tests. During those prenatal visits, with the assistance of ultrasound, some abnormalities can be identified. But rest assured that the vast majority of the pregnancies have no issues. You get all this done during your prenatal visits, but how often do you go to your doctor? How often do you need to be seen by the midwife? It varies, but in general, and I mean in general because it's been traditionally done this way, and not necessarily because there's evidence that it needs to be done this way, during the first 28 weeks of pregnancy, you are going to be seen every 4 weeks. That allows the clinician, the person who's following you, to assess the progress of the pregnancy. After 28 weeks, when the babies are fully developed and are mainly growing, then the visits go more often, and usually they are every 2 weeks. Once you get to 36 weeks, because the chances of you going into labor are higher, and we want to be able to observe for those changes, those visits turn into weekly visits until the delivery. A common question that is brought up by patients is, how many ultrasounds should I get or will I get during my pregnancy? Well, it really depends, but in general, it is usually 2. One for dating, which is to confirm how far the pregnancy is at the beginning of the pregnancy, and this ultrasound happens usually less than 14 weeks of pregnancy, and another one at around 20 to 22 weeks for a detailed anatomy of your child. In cases where there are complications associated with the pregnancy, patients might need to have additional ultrasounds to evaluate for the growth of the baby. Is the same person who's been following you through the prenatal care going to deliver you? Well, not necessarily. For several years, my personal practice was to deliver each and every single one of my patients, which was, I have to admit, quite taxing for me. But it was so rewarding. Unfortunately, in many other instances, and perhaps better for the clinicians, the person who happens to be on call is going to deliver you. So sometimes you're going to go through different clinicians when you're getting your prenatal visit, so you get acquainted with all of them. So a pregnancy is a process that can be filled with uncertainties and concerns. However, you should be able to enjoy your pregnancy. It is important that you're comfortable with the person who's following you and with the process itself at all times. Selecting an appropriate clinical partner is extremely important. So here are the 5 things you should know about prenatal care and you should remember about this. 1. Prenatal care is the frequent evaluation of your pregnancy. 2. Choosing the correct healthcare professional is fundamental for a great experience. 3. Your visits will allow for proper evaluation and management of your pregnancy. 4. All of your questions should be answered. And finally, you should be able to enjoy the process.